So, based on the current symptoms that my patient is experiencing, she is 8 weeks pregnant. She came in complaining of abdominal cramping as well as bleeding that has increased in frequency, and her cramping has become worse over the last 24 hours. The patient does have a history of miscarriages, and they have all presented similarly. As the patient remained in the ER, she did have a confirmed loss of pregnancy. She was able to retrieve a fetus, and the patient no longer had an HCG that was elevating as normal. Because this was a really emotional experience for the patient, I think a lot of counseling would be very, very helpful for her. Not only providing her with providers such as an OBGYN and a primary care doctor to follow up with in the future. I also believe counseling just about why miscarriages happen, making sure that the patient knows that it has nothing to do with her and it's not her fault. Typically, a miscarriage happens if it is not a viable pregnancy. It's a way our bodies are telling us that this pregnancy wouldn't have made it to fruition no matter what. And so usually miscarriages happen early in the first trimester, as this may have caused harm to either the baby or the mother in the future. Although these are all things we do know about miscarriages, it's still extremely emotional. It's extremely hard for a family member to hear. So just providing our patient with those resources, making sure she has good support at home, making sure she's able to calm down, kind of reduce that anxiety that she was dealing with while she's at the ER before discharging her. It's also important to make sure she's hemodynamically stable, check her vitals before she leaves, make sure her blood counts are all good, and then she didn't lose too much blood during the miscarriage. And then just also asking if there's anything else we can do for her before she leaves. I think it's very important that she gets in with her OBGYN within the next week, just so they can follow up. She may even be interested in speaking with a fertility specialist, since she has been trying to conceive for the past 2 years. So these are all great resources for her, educating the patient, reminding her that this is not her fault and there's really nothing she could have done differently. And unfortunately, this is just something that happens much more often than we like to believe or think about. But this is very common, and with her history, she has dealt with this before. So hopefully she has the resources in place that will help her moving on in the future.